So thalassemia, like I said, there is a defective hemoglobin and the blood is breaking down every 3 weeks. So your hemoglobin, the child's hemoglobin is dropping every 3 weeks, and it requires supplementation or blood transfusion, supplementation through blood transfusion every 3 weeks, 3 to 4 weeks. So this should go on periodically, and once the child attains crosses about 10 to 20 transfusions, we do some blood tests to look at the iron status. This is because with every blood transfusion, and inherently these children are susceptible to iron overloads, which can be a problem. This iron can accumulate in the heart, liver and other organs, leading to severe morbidity and mortality. So hence this iron overload management is very important. This can be done through several drugs like iron chelators. So this is how we usually manage thalassemia in the society. But as you can see, this is not a final cure for these patients. The final or a curative option for this patient is bone marrow transplant. So bone marrow transplant at SPARSH we have been doing since 3 years, and we have a team of 3 hematologists who provide round the clock service to such patients. And for thalassemia, the first choice for donor is a fully matched family donor, like an elder brother or a elder sister, younger sister or an elder brother, and who is 10 by 10 HLA matched. So if that opportunity is there, that is there's only 25-30% chances that a thalassemia patient can have a donor in the family. If that option is there, we should go for it, and the success rates are close to 80 to 90%, and they can be done at SPARSH Hospital Yeshwanthpur. If that is not available, then the second choice of treatment is match unrelated donor, in which we look for suitable donors in the stem cell registries across India and outside. And in fact, we have done one thalassemia transplant wherein the stem cell were brought from Great Britain and was transfused here successfully, and the patient now is 1 year post transplant and doing very well. So this is the second choice of treatment in terms of bone marrow transplant, that is unrelated donor transplant. The success rates are close to 70 to 80%. So nowadays there is a newer modality of bone marrow transplant when either of these things are not available, that is no availability of a matched family donor or a matched unrelated donor. Then we can do something known as a haplo-identical bone marrow transplant from the mother or father who are naturally 50% matched to the children. With this also we are able to get 70 to 80% survivals in these children.